Hey all, it's Dr. Steve here from Elevate Sport and Spine. I thought it'd be fun to challenge you a little bit to work on your posture this month. So I'm going to talk to you a little bit about posture real quick and then give you an exercise that I give to my patients to work on these things and then see about how you can improve your posture over the next 4 weeks by doing this exercise every day. So a quick note about posture is that having a good spinal posture can help take stress and pain away from your spine by making sure that everything is kind of aligned the way that it should be. In an ideal posture, when we're looking from the side, the earlobe should be over the shoulder, shoulders should be stacked over the hips, the knees should be slightly out in front of that, and our mats really should be kind of over the middle of our foot, not so far to the back to where we're sitting our heels, not so far to the front that we're feeling it in our toes. You really want to feel most of your weight being kind of distributed right over the middle of your foot. Other things to think about is that we want to make sure that our shoulders are coming into this backward position like this, but also that our hips are not falling into this forward or backwards kind of tilting action where we start to increase our lumbar curve quite a bit. So simple ways to kind of get the lumbar spine and pelvis into position is to squeeze the glutes, and we'll need this for our exercise, so remember that. So I want you to just think about this a couple times, just squeezing those glutes, and as you can see as I do that, it sort of rocks my pelvis back into this position here like this, which is what we need to get this good foundation going. So to move into our exercise, what you're going to need is a nice sturdy wall, and that's about it. So it should be pretty easy to do every day. What we're going to want to do is keep our feet about shoulder width apart, and back our heels up against the wall, squeeze those glutes to get that pelvis in position, and then put our back up against the wall, touch our shoulder blades back to the wall here like this, and then push our head straight back, touch our elbows to the wall, and then turn our thumbs to touch here like this, push out so that we're feeling a nice squeeze in between our shoulder blades, then we'll turn our hands over and bring them up to the sky, all the while trying to keep everything nice and straight in through here. So what you're really going to want to feel is that we're not sort of extending that back, so pushing our back up in towards the wall. Make sure that we're bringing our head straight back as opposed to looking up here like this to touch to the wall, and that we're trying to keep the backs of our hands, once we flip them, in contact with the wall as we go up. With this, especially if it's kind of the first time that you've done it, there's probably a good chance that you're not going to be able to get all the way up here. So what I want you to do is just to work as high as you can, trying to get higher and higher as the month progresses. So what I think is a good scheme to work on is about 3 sets of 8 of these once a day, so you can do them throughout the day. So do a set in the morning, set in the afternoon, set in the evening, but especially after you've been sitting or working for a while, it's a great way to kind of undo everything. If you're finding a lot of stiffness that's prohibiting you from getting into this position, I would also recommend checking out the foam rolling video that I have and working on kind of this thoracic spine stuff in through here before you get into this kind of stabilization exercise. So what you can do is have someone take a picture of you from the front and then have someone take a picture of you from the side before you start the challenge, and then take pictures of yourself once a week in that same position and see if your posture is improving over time. So if you get any dramatic results, then send them my way, and if you have any questions, as always, just ask here at the clinic. All right, have fun. We'll see you at the end of the month. Take care.